Hello everyone, my name is Dr. Liebling Tettey. I'm the lead author of the research paper which I would like to introduce to you. It is entitled Decline in the Mental Health of Prematurely Retired Professional Rugby Players Requires Improved Psychological Support, a qualitative study of lived experiences. The care of everyone's mental health should equal that of their physical health. This is even more important for professional athletes whose mental health is falsely considered to be protected by their physical activities. Clubs take exceptional care of their athletes' physical health to prevent repercussions on athletes' performance. As such, whenever athletes are physically compromised in any way, clubs take every necessary step to support them so that they can get back into action as soon as possible. Previous studies have identified the need for that support to be given in equal measure for athletes' mental health as well. Despite that, there's minimal evidence that those research findings have been put into practice and tailored to meet the needs of specific athlete groups. Furthermore, athletes continue to suffer in silence when mentally unstable, particularly when they are forced into premature retirement. We hypothesized that inadequacy in psychological support for them was the most likely factor that would account for their post-retirement adjustment difficulties. We concentrated on the specific group of prematurely retired professional rugby players because rugby remains one of the most physically challenging sports with a greater risk of injuries. Our research participants were prematurely retired members of the Rugby Players Association, formed as a supportive organization. We used a qualitative approach to test out our hypothesis. This ensured anonymity and enabled participants to express their most intimate thoughts. The results were remarkable. We found similarities between the experiences of current participants and those of previous research findings, as well as their suggested solutions. Our study participants highlighted significant deficits. 6 out of the 14 reported different levels of suicidal intent, and 1 had active suicidal thoughts in the context of compounding financial and family stresses. All participants reported a significant supportive role played by family members in comparison to any other stakeholders. This points to the need for families to be officially involved in athletes' retirement care plans. We offer recommendations to various stakeholders. Our proposals included the overarching need to put theoretical research findings into practice, and for policymakers to mandate sports clubs to safeguard their players during all stages of their professional life. We also call for stakeholders in professional rugby to begin roundtable talks to move research results from theory into practice. This should enhance premature retirement transitional experiences and minimize consequential mental disorders and any possible associated suicidal risks in such players. We trust that you would find some take-home messages from this study that will enhance future research